okay, now we need to do something with them, okay? So we need to draw up into our syringes. This is going to be a refillable flush syringe for me, okay? So I am going to use this multiple times. Now, there's a couple things that I like to show you, and we'll work on this more as we go, but once we get to that, and I'm just doing this so you can see, I don't do this in the lab, but just so y'all can see, and if you can't see, just come a little bit closer. But I already mentioned about air. Now, when I'm just flushing a sheath and a wire, it's not that imperative if, you know, a little bit of air gets in it. But when we do get to the point of our manifold, it is very important not to have any air. So I kind of try to get you guys in just the mindset of, as you're just prepping everything, to try to not have much air, okay? One of the ways that we can get rid of air, I'm gonna demonstrate. So there's really two ways. So every syringe is gonna come out of the packaging with a little bit of residual air in it, okay? You can pump out some of that air by just kind of breaking that original seal, so to speak, pushing the plunger all the way to the top, but there's still some in that little nipple part, so to speak. Okay, so there's always a little bit of residual air. Now just say that I had that air and I didn't push out that was come from original packaging, and I just started drawing up. Well, I've got a pretty good size air bubble in there, right? Mm-hmm. All right, like I said, if I'm just flushing a catheter or flushing, when I hold it up in this position, air is always gonna rise. Okay, so if I hold it here, it's gonna go up to the plunger. If I hold it here, it's gonna go up to the top, okay? If I wanna get air that's stuck at my plunger, I hold it straight up and down, give it a tap, my air goes up, and I can just gently expel my air like that, okay? Now, I'm gonna show you a way that you can also expel air before you ever even, as you're drawing up into the syringe, okay? So just watch what I do, and y'all can get close enough. I know that I tell you, you know, stay a foot away, but I want you to be able to see what I'm doing. You keep the tip under the water, and you want you to watch what happens with that initial air. It's actually gonna come out, and you're gonna see those little bubbles that came out? But there's still a little in my tip. So I'm gonna pull in. A couple more bubbles came out. I'm gonna pull in. A couple times. No air in my syringe. So it's kind of like I was burping it, getting rid of the air. So that is a way that you can do that. And that's my habit. I've just got myself in that habit, that anytime I'm drawing up, that's how I'm gonna fill my syringes, okay? With this original syringe, or like I said, this is gonna be a refillable syringe for me, so I'm gonna fill it completely. I probably am gonna use another 10 cc for flush for myself. I'm gonna fill it completely up. Here's where those little details come in. So these are gonna be for my doctor. All right, I'm gonna get his syringes ready for him that he's gonna be using over for the procedure. Now, when a doctor is using a syringe, they're not flushing catheters and sheaths. They're actually flushing into the patient's body, okay? And so every time we flush into a patient's body, we're gonna make a connection. I'm just gonna go ahead, kind of demonstrate. We're gonna have to make a connection. And even if this is filled with fluid, which when we prep it, we're gonna have it filled with fluid, every time there's a connection point, there's an air bubble that's gonna be there. It's just how it is. So if I just say this was in the patient, and I open the stopcock and I start flushing into the patient without drawing back first, I'm gonna push air into the patient, okay? So every time, and we're gonna get this in more detail later, okay? But to help you understand why, we're not gonna fill these syringes completely full for the doctor when we prep them and get them ready. Because the doctor needs to have a way to pull back. They have to have enough room. It's called aspirating, okay? So they have to have room to pull back, clear any air, and then they'll flush forward, okay? So That being said, if I'm prepping this syringe for the doctor, I'm going to get about 5 or 6 cc's and just set it to the side. Okay, and so that's ready once I drape my patient to go over and set where I'm going to set it. Okay, my blade is ready. These I'm going to use to flush items. I'll do that in a minute. I'm going to go ahead and get my lidocaine drawn up. So if it's femoral, I'm going to do 2 10 cc's full. Now, this is where some people get confused. We do have to do a little bit of aspiration, and I don't want to get too far ahead of myself. Once I teach you access, then you're going to understand that. But we have enough room. We don't have to aspirate as much as we do with these syringes. So we are going to fill these syringes full. I don't need a needle. I'm going to kind of do the same thing. If there's a little air in this, it's not the end of the world, because this is going into the tissue. So lidocaine goes into the tissue, not into the vessel itself. Okay, so I have my 10 cc's, and I'm going to go ahead and place my safety needle. I should have done this while y'all were gone. Not letting you watch me. I hope I don't poke myself while I'm trying to do it. This one's bent a little bit, so I don't know if it's gonna work. Doesn't really matter that I use this one specifically. It's not gonna let me do it. So I'm gonna use this other needle. It's fine. I use this short needle. And that was my lidocaine. Short needle, that's ready to go. Long needle. That's ready to go.
One short and one long?
Mm-hmm. Femoral.
Oh, femoral.
If we were going radial, and like I said, we'll get more detailed in the spring if it was radial, and then once you get out in clinic, you're gonna hone in on all of this as you do procedure after procedure after procedure every day. But radial would be just the short, maybe a 10, maybe just a 3, full of the lidocaine. Okay, but now those are ready to go once I drape my patient. All right, now I want to flush my sheath. Okay, so everything that has a lumen has to be flushed, right? 2 reasons to flush items. First is to lubricate the items. Second is if there was any residual dust on it inside the lumen from manufacturing, we could get that out. Go back to this flush. This flush bowl needs to stay as clean as possible. So that's why I use a waste bowl and I don't squirt blood back in here. If I've got blood in a syringe, I'm gonna squirt the blood back here, and then I'm gonna get clean flush in a syringe. So I always wanna try to keep this flush as clean as possible. So I don't want to, you're gonna see a lot of people do it, but flush back into this bowl when I'm actually flushing my item. So either I flush and it kind of might hit on my tray. It's okay if we get a little bit of fluid on the tray. You'll actually see some people will take a towel and lay it out here to try to just keep the little bit of water from being on there. It's okay if it is though. This is water repellent for the most part. This one layer, it actually will soak up some of the fluid, but then this part that's underneath, it's water repellent, okay? But if you are gonna try to flush into a bowl, you always wanna flush into your waste bowl. The dilator, I'm gonna give a flush first. And it's just a little wash through, okay? Now, the sheath is a little bit more difficult. It has a stopcock. Now, stopcocks we're gonna have to learn how to use. We have stopcocks on our manifold. Stopcocks are like a door, so to speak. So they turn on and off, okay? So when it's off, you can't get anything past it. Okay, these are called handle off stopcocks, and so it actually says off. This one does, not everyone is going to, but that means that wherever that is pointing, it's off to that direction. There's 3 little arrows. That means that all of those arrows would be on. Now there's actually little holes, and you can see at all of those arrows. Do you see that little hole?
Mm-hmm. Where's the hole? Oh, okay.
Okay, but I'm just going to turn the off. There is no hole. A little bit harder to tell. Let's see if I can do it. There's no actual hole on the off. It's solid in there. Okay? So, that being said, when we flush the sheath, we want to make sure that we flush the whole lumen of the tubing and the sheath. We also want to make sure that it holds, that fluid holds in here, so it doesn't leak out, okay? So, just to demonstrate the holes first, if I connect to this end, so that's an open. Now it's closed because there's no hole like this, or no lumen on this side. So right now, if I flush, that's my pathway. It can't go past because I'm off this way, okay? Now, I open, I go through this way. Now I have a path from here to here that's open. If I were to turn my stopcock this way, nothing is happening. That's leaking out, but I can't because I'm off to the syringe. Okay, does that make sense? We really never turn this stopcock that way. But once we start working with the manifold, then that might make sense, more sense. So to flush your sheath, I kind of do this as a bathroom, because my boys never turn the light off when they leave the bathroom, okay? So what we're gonna say is, all right, this is us, this is our bathroom, we're gonna go into the bathroom, we're gonna turn our light on. That's just a quarter turn, okay? That opens up that lumen for us to be able to flush the sheath, okay? We flush, that's us doing our business in the bathroom, okay? We want that to stay in. I'm gonna demonstrate what happens in a minute if you do not turn the light off before you leave the bathroom, okay? Not only do you make your mama mad, but you lose all your flush that's in this situation. Turn the light off, then leave the bathroom, okay? Now, we have a column of fluid here, and there's actually a column of fluid still in here. And we call this sheath being flushed, okay? This is what happens if we don't turn the light off before we leave, if we leave first. And this is what we don't want to happen. See how all that leaked out? Now I can go back and turn it off, but now I have air all in there. And you don't want to start the procedure with air all in this tubing. Some people just completely 100% forget to turn the light off ever. You stick it in the patient, blood's gonna be coming and start pouring out, and it's gonna be sitting, it's gonna be sitting right here. And who's standing right here?
Doctor.
So what's gonna happen?
Blood's
gonna come out, maybe hit all over their legs and their feet. They're not gonna be happy.
No.
You would only do that probably one time, just saying. But we don't wanna ever do that if we can help it. So this is our proper way to flush. Connect, quarter turn, flush, quarter turn back off, and it's always it's just one little motion. Quarter turn on, quarter turn off. Back in the same way, then remove your syringe. Then you have flushed your sheath. The last thing is then to put your sheath together. That should click. Now you have your sheath assembly all ready to go for the procedure. Okay, that looks easy till you start trying to do it, right? A lot of people have a lot of issue with this right here. But we're gonna get it, we're gonna work on it. For our wire, so there's no lumen to the wire, there's no hole in this wire, all right? But we still like to lubricate the outside of it, and so what we do is we just keep it in the hoop, we connect our syringe, and we do a good flush. I've already flushed this one, that's why there was some in there on the last. And now we can say that that's prepped and ready to go into the patient, okay? Now, we're gonna get some catheters from our circulator. And I could have used this 10, I could have used the bigger. I tend to use the bigger one for the manifold. So that's another piece that's going to be on here, and you're gonna have to prep, but we're not gonna do that yet. So we're gonna baby step it. And this is what we need to get to for the practical, okay? So she's gonna make sure this is the catheter that I want, and we'll get into more detail about the procedures, what specific catheters we use for what specific procedures as we go. She's gonna make sure that the expiration date is good. And then remember how we talked about there's a certain area that's better to open from, and also let them know about the hub with the catheters.
Okay, so you'll check the expiration. You always show them before you open it, just so they know that this is what they want. You'll always open on the end of the hub, not down here, because I guess you could bend it.
Yeah, and it's just harder, and plus it's hard to open down there anyway. But also it's just easier to grab from the hub and pull it out. And the hub part is the part that's going to be outside of the patient. The other end, that's the part that will be going inside of the patient. Okay.
So then they have like a little separation part that you could open. And when you open it,
It's kind of like peeling a banana.
you wanna hold this piece and this piece.
Okay, and I'm just going to take the catheter. Now the way she's gonna know that I'm just gonna take the catheter is I'm just going to I'm gonna grab the piece of cardboard, but then I'm gonna take the hub and then I'm gonna pull out. She needs to make sure that she's got a hold of the cardboard out on the outside and a hold of those two flaps. I've done this. I let one of the flaps go, it hit the scrub tech, and it contaminated the catheter and it contaminated the scrub tech's gloves. So you wanna make sure you have a good hold on these two flaps, okay? And I'm just gonna pull out, control it. I'm gonna flush it, it has a lumen, okay? Hole running through the whole thing. And I'm gonna secure it. Some of them, some people will just lay them straight on the tray. Some people like to loop them in one big loop and then set them on a spot on their tray. These would be gone probably by this point, maybe, and I might set them over here. Some people will set them at the end of their table on top of the sterile drape. People do different things. So she's gonna give me another one, and I'm gonna pull the cardboard this time. So two different ways it can be done. Okay.
So I've actually had a situation where I held the entire thing, so as they pull, it's not coming, and I'm like, grab it. And they're like, let it go.
So if I grab for the whole thing and start pulling, that's when you gotta know, oh, they want to pull the cardboard. And different people do it different ways for different reasons. The method to the madness a lot of times is that there are certain catheters that if you pull through these holders, it will kink it and bend it. So there are certain catheters that I actually do pull out with the cardboard, and you'll just kind of get to know that. Unfortunately, sometimes it's trial and error. If you're going cath, I'm gonna try to teach you. You may not remember when you get out there, because it's really two specific catheters, and it's for intervention. It's not these diagnostic. But sometimes, like if I'm in a hurry, and especially over here, I've been where I'm trying to help the doctor do something, and the doctor's asked for another catheter. The circulator's got the catheter there, They're standing there waiting on me, but I'm kind of trying to help. And I'm like, go ahead and open it. They'll open it. It's easier to control all the cardboard than it is to control the single catheter. So there's been times that I've just grabbed the cardboard, pulled it out, and let it lay just here, just so that I've got it passed off, and then I'll take it out of the cardboard in a few minutes. But those are different situations. Why? Because otherwise, I hate the cardboard. Because then you just have to take it out and get rid of your cardboard. Because I don't want all this on my tray. Any extra garbage, I'm going to get rid of. Flush it. Okay. And now, pretty much, I'm just going to kind of get this stuff back here. Oh, my percutaneous needle. Just going to give a little flush. And now I have pretty much everything that I need other than my manifold to get ready for my procedure and to be able to set up over here. Okay, so y'all can take a picture of this. Again, it just kind of gives you an idea. What I am going to have you do is draw, and I want you to actually hand draw it in your little book. So even if you take the picture, I want you to hand draw it and label. Okay, and just go ahead and try to, you can just draw little syringes sitting over here. It doesn't have to be perfect, but your biggest things are, I want to make sure you understand your flush bowl, your waste bowl, like your trash bowl, your sharps, your 4x4s, your towels, your drape, and then this can kind of be an open work area. And you can draw little syringes, little needles, your wire, your sheath, to the best of your ability in your little book. That'll just help you that once you get in the lab, and if you are having to set up, just a little reference. Okay, so if y'all want to take a